welcome you all to this meeting of a public health group of PUAN. This is our second meeting. I hope that you all have received your membership letters signed by PEO Raymond Castillo, and thank you very much for voting on the survey and picking up the topic of distribution of vaccine and access in Pakistan. So I would like to, at this point, invite our staff from the US mission to introduce themselves to the members. So first of all, it's me in opening. So I'm Usman Sadiq, Deputy Country Alumni Coordinator. I work with Shahid Saab and Lynette in alumni team at US Embassy. Lynette, would you like to introduce yourself, please?
Sure. Good afternoon, everyone. I'm Lynette Franco. I'm one of the Assistant Cultural Affairs Officers here at PAS Islamabad, and I get to work with the alumni team as well.
It's popcorn mode, so anybody who's from the US mission and the US CFP can, introduce themselves.
Good afternoon, everyone.
Thank you, Usman. This is Shahid.
Hi, Kahina.
Hi, I'll be quick. My name is Kahina Robinson. I'm the Public Affairs Officer at the U.S. Consulate in Peshawar, and I am very happy to join today, but we'll have to leave a bit early. Thank you.
Kahina, thank you very much for joining in today. Thank you. Shahid Saab.
I will be the last one now. Okay, thank you, Usman. So this is Shahid Wasim. I'm working with Usman and Lynette as a country alumni coordinator, and thank you everyone for joining. So looking forward for this.
Assalamu alaikum everyone. Hamza Lakhani here. I work at the US Consulate General in Karachi, and I'm managing the cultural programs and the alumni programs at the consulate. Thank you.
Thank you, Hamza, and thank you, Shahid Saab.
I'm Shanila Mazhar, Communications Officer for US CFP.
Shanila, we are always thankful to you for your help and support. Thank you.
Thank you.
Vakar Saab.
Hi, everyone. My name is Mike Berenson. I work in the economics section at the US Embassy in Islamabad, and I cover environment, science, technology, and health. So happy Friday, and I'm looking forward to the discussion. Thank you.
Mike, thank you very much for joining us. Thank you.
Hello, this is Vakar Khan, alumni officer working out of USAFP PUAN, and I work with Lynette, Shahid, Usman on alumni affairs. Thank you for joining on this Friday afternoon.
So today, as we have already informed you that Reena from USAID, she serves as the Deputy Director of Food, Nutrition and Population. She will be joining us and will be talking to the group members as well. I would like to request the alumni members to introduce themselves now, please. Anyone who wants to go first, the slot is yours.
Okay, so good afternoon. Dr. Faisal Abbas here. I am Associate Professor at NAST, and I did my PhD on health economics, public health issues, and nowadays I am working on undernutrition, child health, mother health, and impact of macroeconomic and public policies on health of children and girls. And I am at the moment at NAST Associate Professor. Thank you.
Thank you very much, Dr. Faisal. Dr. Faisal is also a member of our Environment and Energy Group. Dr. Faisal he's a mentor in the PUAN Summer Internship Program as well. So, Faisal Saab, thank you very much for your active participation. Who wants to go next?
You.
Fariha, would you like to introduce yourself to the group?
Oh, sure. I was just waiting for someone else to speak up first. My name is Fariha. I'm a medical doctor and a public health specialist. I work with the government of Punjab as the public health specialist in healthcare department. Primarily, we are
Your voice is breaking,
a bunch
Fariha.
of areas, including One Health, which ties in very neatly with the environmental health group, children's programs. Can you hear me now?
I can hear you now.
Oh,
Yes.
okay. So I am working as public health specialist with government of Punjab health department, and we are working on school children's nutrition, as well as
Right.
One Health, which ties in with environmental health and other work that Faisal is doing. So yeah.
Right. Thank you very much, Fariha. And who is going to be next? Dr. Rakshanda. Please.
Hi, Rakshanda. Yeah, sorry for joining late, and welcome to Reena, and excited topic, and would like to hear from other colleagues. Thank you, Usman.
Thank you very much, Dr. Rakshanda, for joining today. Who wants to go next?
Hi. Hi, this is
Sorry, who
Dr.
is this?
Sophia. Yeah, this
Hi,
is
Dr.
Dr.
Sophia.
Sophia. Yeah, this is Dr. Sophia. I'm a Fulbright alumni and working with MFNET as a technical consultant in Pakistan. Right now, I am supporting the CDC supported projects in Pakistan. Thank you.
Thank you very much. That's very interesting. We have a spokesperson from CDC as well, Chrissy. But Umar Dil from Peshawar. Umar Dil, please go ahead.
Thank you, Swan. My name is Umar Del, and I'm working in social sector from the last 15 years. And from 2014, I am working in public health. I joined WHO in 2014 as a provincial campaign officer for polio education program. And then I went to US as an Atlas Star Fellow, and I remained for a year in Washington, DC. And coming back, I again joined WHO as polio education officer, and I worked there for 3 years. And currently I'm working with UNICEF as a district health communication officer in district Banu. Thank you, Swan.
Thank you, Umar Dil. Thank you very much. We have now Chrissy from CDC. Chrissy, please introduce yourself.
I couldn't get off mute. Now I'm off mute, sir. Hi, I'm Dr. Christy Reed. I'm the CDC country director here in Pakistan. I'm internal medicine and pediatrics, but a most career in public health, from President's Malaria Initiative in Liberia to global immunizations in Kenya, and now here in Pakistan. And delighted to be interacting with this very interesting and informative group on issues of great concern to everyone. Thank you.
Thank you very much, Chrissy. So, taking the discussion forward, as we all know that we had a survey last week, and the most of the participants have voted for the topic for today's discussion, and that is vaccine distribution and access in Pakistan. So I see there are a lot of group members who are, somehow related to this topic. Like Umar Dil, he is working with WHO in KP, and he is related to the vaccine distribution of polio. But I see that there is some convergence with this vaccination for COVID as well. Osama Javed has joined us. Welcome, Osama. So, Osama, would you like to briefly introduce yourself before we move on with the discussion topic?
Hello, Assalamu alaikum. My name is Osama. I'm the CEO of a social enterprise called Saving Nine, and we're all about teaching people how to save lives through first aid and mental health education. I have a master's of education from Columbia University, and I'm also a licensed emergency medical technician from New York State. Nice to meet everyone.
Thank you very much, Osama. So moving on with the topic of discussion, vaccination. How is the vaccination going in Pakistan? What are the fears of people? What are the updates? Is the vaccine enough in Pakistan? How are the people responding to this vaccination? I have seen many educated people, filing cases in the courts against the obligation of vaccination. So these kind of updates, these kind of knowledge that our group members would like to share with us. We welcome your opinion, knowledge, ideas. Who wants to go first? Maybe Umar Dil, maybe Dr. Sobia Faisal from CDC. She's related with CDC project.
Sure, Usman. Can I go first?
Yeah, sure. Please. Thank you very much.
Thank you, Usman. So far, Pakistan have received 13.5 million doses, and 3.5 million people are vaccinated so far, which is 1.6% vaccination percentage, which is very low. And if we see, like I'm just giving the district Bannu vaccination status, which is so far, which is 20%, which is very low. Yes, so there are a lot of fears in the people, in the mind of the people, in the communities, because previously, if you see, from the last 25 years, we are working on polio eradication, and so far we are not successful. And still there are doubts in the mind of the communities. And the same is happening currently with the COVID-19. There are a lot of conspiracies, a lot of questions because we are spreading. I am in the ComNet communication network of the polio program. So our task is to give awareness about the COVID-19 vaccination. So when we are going to the communities and giving them the awareness and the importance of the COVID-19 vaccination, so there is a lot of misconception about the vaccine. And so for that purpose, we need a lot of advertisement, a lot of advocacy, a lot of motivation, a lot of work to do. Because so for, like in polio, there was 3 MPO. Like the government were vaccinating the child by force, and then in this government, that 3 MPO have been stopped, and now we are if there is someone who voluntarily want to vaccinate their child, so so they can vaccinate. Otherwise, we can't force them. So currently, I am seeing that in COVID-19 they are vaccinating by force. And if they are not vaccinating by force, the average will go down further. But I am not in favor of by force vaccination. We need to have a proper mechanism of advocacy, communication, and awareness. So I would suggest like a huge campaign of awareness, so that people go by themselves to the centers for vaccination, not by force. Thank you, Usman.
Thank you very much, Omar Dil. This was very good information that we have received from you. And it is very surprising for me that the polio vaccination is not mandatory anymore. You cannot force people to get their kids vaccinated. What to say? A long way to go. Who wants? Long way to go. So who wants to go next on this topic? And if there is anyone who has joined recently and has not been introduced to the group, please feel free to introduce yourself. Dr. Farhan Isa from Sindh has joined us. Dr. Farhan, welcome to the meeting. And would you like to briefly introduce yourself?
Thank you very much. It's a privilege to be here, and thank you for inviting. My name is Professor Dr. Farhan Isa Abdullah, and I'm basically a clinical microbiologist, trained as a microbiologist, but now working more in management. I'm associated with lots of health associations like Pakistan Medical Association. I was the vice president of it, and I led the Federation of Pakistan Chamber of Commerce and Industry for last 3 years as a chairman for Hospital Clinics and Labs Committee. And I'm involved, I'm a member of the National Polio Plus Committee promoting vaccination, especially for polio.
Your voice and video just got stuck. Okay,
Sorry.
I believe you.
Yeah.
Okay.
So I was Rotary District Governor for District 3271 Sindh and Balochistan. 30th of June was my last date. So this is a little bit about me.
Thank you very much, sir, for joining us. Yes, sir.
No,
you
that's
wanted
it.
to say something? Okay, thank you. So, sir, as we know that you are related to this laboratory and testing process of many diseases, but when talking of COVID, and so how is it? How's the process going? What are the result rates that you are receiving these days in your region?
This is, I mean, it's very interesting about the COVID situation, especially, and the testing processes. We are one of the pioneers of in the diagnostic industry who started COVID testing. Excuse me for a while. Yes.
Sure.
Yes, sorry, there was a meeting going on. So,
no problem.
So basically, we were the pioneers to start COVID testing in Pakistan, and we had a lot of great experiences to learn from and did a lot of good work. We were also involved in the first isolation center made in Expo Center, Karachi, which was later converted into HDU and ICU with ventilators for COVID patients, which is still going on. And we are providing free lab services. ISA Lab is providing free lab services from day one. And our labs definitely all over Pakistan are providing these tests for the patients and for airline passengers. So I'll break this question into, subdivide it into 2-3 parts. Number one, the first part was the initial 3 months were, people were really scared about the COVID. And let me tell you one more thing, that all results which we do with the tests which we do are reported to the NCOC, which is the National Command and Operations Center, which then has these figures which it releases to all these organizations and the stats. So unfortunately, in the initial 3 months, all the people which were getting tested, they were very afraid and they were concerned, and they got themselves tested, and they were, the percentage was pretty high. And these reports were going to the NCOC also, which were adding in the statistics. Now, the current situation is this, that the people are taking it easy. So our numbers have gone down, but I won't say that they are the right representative figures for the community. If you talk about Karachi, our district east, which is Gulshan, Gulistane, Johar, and these areas have the highest COVID coming, which is, I would think it is around 18%. Still
18%. Oh,
yes. And then we have south of Karachi, which is again probably around 12%. And then we have the district west, which is North Nazabad and Nazabad and Liaqatabad and North Karachi, which is giving an artificial figure of 8%. The reason being the people are not getting themselves tested. So, these are the people who, if one person gets COVID positive in the family, then if there are 6 or 7 individuals, usually these are small houses, and a lot of people are living in those premises. They don't get themselves tested. They just go into isolation, and that's why the figures are lesser than what they should be. Fourth is that many people are now not getting themselves tested, although they think they are exposed and they are confirmed to be positive, because they feel that it will be a stigma. And what is the wrong thing which is happening, which we are trying to create awareness, is that these people just take 2 days of rest and Panadol, and they feel better, and with slight feverish position, they still go out and go to their work, and they are spreading these infections. Now, if we talk about going outside Karachi, the percentage of tested in Hyderabad is, let's say, 50% lesser, and as we go further down, the percentage is as hardly people are getting themselves tested. So the figures which are getting lesser, the whole country's figures which are getting, the numbers are decreasing, is the reason is people are not getting tested. or they are still not taking it seriously. About the vaccination, it's very interesting that let's say a couple of days back, I had seen that, let's say, for example, 400,000 people, if they had taken the first dose, only 300,000 had returned for the second dose for vaccination. 100,000 went missing. And it's very interesting that, this same thing is happening for polio also. In Pakistan, unfortunately, the biggest, if you tell somebody that if you get vaccinated, a person might get brain dead, stroke, or their eyes might go blind. They don't, rather, their heart may stop beating, or the kidneys will fail. It doesn't matter to Pakistanis. But when they get this rumor that it causes infertility and you can't have any more children, they go bonkers, and this is a rumor which is spreading. So I think we really need to work together to prevent this. And this is the same thing is for polio also. And unfortunately, people say we won't get our daughter or our son get polio drops, and the reason is, like, if we get, they won't be able to reproduce. And I always tell them, that 25 years plus has gone, that the polio is being, where children are being vaccinated, and the population is really increasing. So if polio drops were supposed to do this, it's not doing their job. So I think we need to work together to stop this anti-vaccination campaigns, and that's the only way. And at this point in time, probably 10%, hardly 5% probably of people in Pakistan have been vaccinated. People are not coming to get themselves vaccinated for COVID. And if 60% plus people do not get vaccinated, and for 50%, for 60% people don't get vaccinated, or they don't get well after recover after COVID, then there won't be herd immunity, which is, if 60% to 70% people get vaccinated, or they recover from a COVID, then the rest of the 30% people get protected by this vaccination. And this third wave has just finished, and I think these waves will keep on continuing till we have this ratio. So I think we all need to work together to get rid of these concepts and create awareness regarding vaccination. Thank you so much.
Dr. Farhan, thank you so very much for giving such a detailed insight on this issue. Now we have Reena with us. She has joined the meeting right now, and let's see. Reena, would you like to please introduce yourself and the work that you do at USAID for our group members? Thank you.
Thank you so much, and apologies for being late. I'm actually dealing with a bit of a real-time public health issue. So, and that's the reason I'm late. So, putting work into practice here. I am the Deputy Health Office Director of USAID Pakistan. I arrived in November. Prior to Pakistan, I've served in Brazil, Mozambique, and Zimbabwe, as well as Washington, D.C. And I've been here in Pakistan during a very interesting time amid the COVID-19 pandemic. I manage an office of, I co-manage an office of approximately 10 people between Islamabad, Lahore, Karachi, and Peshawar. And a lot of our work at the moment is focusing on supporting the government of Pakistan with the global health security agenda. So to protect Pakistan as well as its neighbors and global partners against infectious disease threats. And that includes polio as well as the current COVID-19 pandemic. In addition to that, we've had existing support in maternal and child health and family planning and strengthening routine child immunization activities as well, and health system strengthening and strengthening the quality and access to health commodities and medicines.
Thank you very much, Reena, for this introduction and the work that you do. So, Dr. Farhan, Okay, you are answering in the chat. So, Dr. Rakshanda, would you like to talk about how this pandemic is affecting the work that you do? I mean, you are a medical doctor, but you have chosen to work in the field of social work and especially in entrepreneurship, which is a very unique kind of a blend. So, please educate us on how the business is doing for underprivileged sector in Pakistan during this pandemic.
Okay. Thank you, Usman. And thank you for interesting introduction, because entrepreneurs and social scientists think that I'm a medical doctor, and medical doctors think that I have led medicine.
Yes.
So I am an actually intersectional feminist with a degree in medicine and post-graduation in public health, where my concentration was and is remains gender and development. So, and entrepreneurship is my passion, and I wanted to do it. I'm a free soul, but sometimes I also do consultancies, and I work very seriously. Okay, now coming back to this whole scenario, it has, like elsewhere, impacted all marginalized people disproportionately. Women are also affected, more affected, and women who are not in any stable job and who are doing entrepreneurship and they're really owning it and controlling it, they have been affected a lot. And because indoor activities are not allowed, as most of you, or maybe some of you know, that I established a co-working space in 2016, and so that is closed. We are active digitally, and you can visit Cafe Calm official. Cafe, for my English-speaking audience, is an Urdu word. It means joy. So it's, and calm means work. So it's joy of work. It's not the cafe where you offer coffee or food. So this is a very real setback, and regretfully, all those who claim to care about startups and ecosystems, they're doing fancy things, they're publishing glossy posters in immaculate English and etc., but nothing for the people who are working directly with the communities, even people like me who are urban, modern, aware, educated women, and we don't know from where to get the help. Health does not mean, applying for an interest-based loans. It is about being empathetic and to understand that what is exactly going on, at the grassroots level and the field level, and what has happened in this pandemic. Apart from this very, personal insight, I remain concerned about the issue that I have always cared most about in my entire career, that is gender-based violence. And this year too, I got an opportunity to write a research report with the help of our partners and donors and technical aid agencies. I was asked to do it as being the architect of this study since 2000. So then I looked at the scenario, and in Pakistan, the number of reported cases actually increased during this pandemic. And this is also very alarming, because if the reported cases are increasing, imagine that what is actually going on. As we always say, this is when reported cases only represent tip of the iceberg. So yes, we are in a crisis, praying and hoping that it will end soon, but a lot depends on official policies and support to women who are in this entrepreneurship and who are doing it on their own. And this is my parting comment, why I am actually emphasizing on their own, because there are a lot of women, and maybe some start hating me when I say so, but I'm not contesting any elections or looking for a popularity vote. There are many, many, many businesses that are launched in the name of women. You have put some women on the front, but they're not established by those women. They're not owned by those women. They're not controlled by those women. It is just, the diversity and inclusion clause that they are meeting. So this is a very ceremonial, if not unethical thing. So the women who are actually into business and they have established it, they are suffering a lot, and their side of story is yet to be heard and documented. And this vaccine has added to the jeopardy. I too did not receive, just one last thing, I read something in the chat box, the message for the second dose. And then I actually approached them and I told them that this is what's happening. And they said, it doesn't matter, you can have it even after 6 weeks. And then I disclosed my identity. I said, I am a doctor myself, and it has always already late, like by 72 hours. And then I was given another appointment after 2 days.
Well, that's very interesting. Dr. Rakshanda, very briefly, is businesses for underprivileged people is improving after the arrival of vaccination in Pakistan? Now, do you think that vaccination process in Pakistan is bringing a positivity in the business? Very briefly, please.
Yes and no, because I talked to the people who work with big businesses, and they want their jobs back. They want the clientele of that business back, and they all got vaccinated. Like the restaurant staff, they got vaccinated, but they're waiting for the clients and the customers because the pay scales are not good, and a lot depends on the tips, because owners are rich, but they are holding the salaries. So vaccination is the real hope for the revival of the industry business.
Right. Thank you very much, Dr. Rakshanda. Now we will move to Dr. Sobia Faisal. Dr. Sobia, very briefly, if you would like to share your opinion, knowledge about the vaccination going on in Pakistan, please.
Thank you so much. We all know about the myths and concepts about of the community about the vaccination. So we all know that there are various challenges at different levels. And one of the challenges in the early phase was that people usually, when they develop symptoms or somebody in their household is positive, they usually try to get vaccinated at that time. So at that time, they might be they have the virus and they are actually positive. And once they are vaccinated and after 2 days, they got a positive test, they blame it on vaccine, which is a common practice. So this is another problem for vaccination. So the challenges we all know, but there are some good things also going on. So we should also discuss them. Regarding the healthcare worker infection, if we look at that, the healthcare worker infection among the total COVID positive cases is declining, which is a good thing. And on the same side, the vaccination among the healthcare worker is also at the increasing trend. So this is another good thing. And during the, during these times, different organizations have polls for vaccination and trying to figure it out that who is going to uptake that vaccine and who is not. So sometimes some things happen, like whatever, the situation happened in India. After that, the COVID vaccination demand was increased in Pakistan, and one of such a poll described that before the COVID Indian episode, there was around 45% of the population which was interested in getting the vaccine. But after that, that percentage increased to 73%, which was a big deal, just because of media involvement and the Indian episode. And after that, people realized that they should get vaccinated. So these are some points which has helped Pakistanis to get more and more people vaccinated. Thank you.
Thank you very much. Thank you very much. So Osama, you still need to share your opinion as well, but at this moment I would like all of the group members and our staff from the embassy to ask any question from anyone if you have any questions. So if the group members want to ask a question from the mission staff, or the staff wants to ask a question from the members, please go ahead, shoot your questions.
Can I add something?
Oh, go ahead.
Who is this?
Okay, if there's a moment, yeah. Sorry, I think I cut someone off, but I had a question kind of going back to all of your comments about, I think we all recognize that we need widespread vaccination to really put this pandemic behind us. And we have, it seems like, two kind of distinct challenges. One is vaccine hesitancy, and that is not just a problem in Pakistan, it's a problem in the United States and a problem all over the world. People have to want to get vaccines. So thus we want to promote vaccination and have public awareness campaigns and make sure people want to get vaccines. However, and Dr. Reed and Rena and a lot of us talk about this a lot at the embassy, there's also a global demand for billions of vaccines across the world, and manufacturers are having we're just globally, there's challenges in manufacturing and distributing enough vaccines for everyone who wants them. So as kind of the supply takes time to catch up, how do we balance promoting vaccination and promoting and getting people to want to get vaccinated with potential supply issues? And I think Dr. Farhan, you mentioned in the chat, there was a supply issue a week or two ago in Punjab, and I think in some other places there was a temporary lapse in doses available, but then supply has caught up. But one thing I think about is right now the balance seems to be okay, but what if we get to a point where not enough people want vaccines and we have too many? On the other hand, too many people want vaccines and there's not enough. So I'm just curious about the thoughts from anyone in the group, kind of how do we solve that problem? Over.
I would like to add, if possible, it's a very nice question which has been put up. I would suggest, I would suggest we should climb our mountains when we reach them, maybe. At this point in time, we have very less people getting interested in vaccination, and now we have received a lot of vaccination, as I'm pretty much updated about what is going on, and we've got enough vaccination for now. And I think, let's get the process of vaccination and creating awareness. I would suggest even if the supply is less, we should continue with the awareness program and let people get more interested in getting themselves vaccinated, so that one can calculate the number of doses which are needed also. Actually, what happened here in Pakistan was that some centers, there was quite a big of rush, and they did not know how many people would turn up for a vaccination. So nothing is constant. So in my humble recommendation is we should push in the awareness campaign. I'm also doing it on television, radio, and social media, especially, destroying the myths about it. And we should encourage people to get vaccinated. And when the doses come, they'll be managed. And if they have a little bit of delay, I think, still it is better. Many people have gotten one dose and then the second dose was an issue. They are still better off than getting no vaccination. But I think the things are catching up, and now vaccinations are being brought in quite a big number. Unfortunately, the private sector was not encouraged that much. They would have managed more. But I think the process is continuing, and I would suggest in the end that we should encourage awareness and updation and let people wait for the vaccination if it comes short, and hopefully it will be sorted out soon enough.
Thank you very much. Anyone else who wants to answer Mike's question or his or share your opinion on how to balance the supply and demand gap, and or how to increase the demand as well when because it is needed? Anyone who wants to share his opinion or her opinion? Okay.
I'd like to
Thank you very
generally
much.
add that it's a bit of a public communications challenge. It's a marketing challenge. And we have to acknowledge that there are tremendous political currents at play that influence it. For example, it's not that there's a lot of people who want to get vaccinated, but they want to get vaccinated with a particular brand of vaccine. A lot of people, for example, in Pakistan are just very hesitant about AstraZeneca because of all the horror stories they've heard in the media. And I want to share two contrasting articles that really help sort of, elaborate upon this. So I'm just putting that on the chat group. The first is by The Guardian, and it kind of highlights the story of how the AstraZeneca Oxford vaccine was over time demonized. And then I want to also share this New York Times article, which is kind of doing the same thing about the Chinese vaccines. So because inevitably there's such a sense of political achievement that comes along with pioneering vaccines across the globe, there is also a tendency to downplay the efficacy of a competitor country's vaccine. And this then trickles down to how third-party countries begin to interpret which vaccine they should take or not. So we often find in Pakistan, and I'm talking about people in the middle class and in the upper middle class as well, they just simply refuse to go if they hear that it's AstraZeneca, or that even if they heard that it's Sinopharm, everyone wants Pfizer. So it's not just a matter of getting people to want to take the vaccine, it's also a matter of getting them to be accepting of various vaccine brands. And one thing that I've realized through my grassroots community work in rural Islamabad and beyond is that it really helps to have local influencers show that they've taken the vaccine. So it's not just about Imran Khan on TV taking the vaccine or about high-level people taking the vaccine. It's also about people in the local communities, the local Maulvis, the local, sports players taking the vaccine. It makes a big difference, a very significant difference. It's when you see your family members taking it that makes a big difference. And I feel that that sort of targeted campaign is not currently occurring. And if it occurs, it'll really help address this challenge.
Osama, thank you very much for such a reasonable, such a sensible opinion sharing with us. Marvelous. Thank you very much. Now, Umar Dil, please, you have a question or answer, I guess, to Mike's question. Please.
Thank you. I have a few of the comments. One thing the sir have discussed is vaccine brands. And he also discussed about the local communities. I'm going to second him, because the local communities, they are vulnerable. They don't know about the brands. Maybe in the big cities, they know about the brands, but the local communities, the vulnerable communities, they don't know about the brands. So we need to devise policies, and we need to reach to these communities, to the vulnerable, especially the senior citizen and the disabled people. So mobile vaccination is one of the strategies which will really works. Like if there is a school, a college, and the health departments, tell them to give us a list of your employees and gather us like 50 to 100 employees, and we will come there and we can vaccinate your staff. And through mobile vaccination, we can reach to the far-flung areas, to the communities where the health, the technician go direct to those communities and they can vaccinate the people. And for that, we also need to have an advocacy session communication plans, like involving the influencers in the communities, engaging politicians, like engaging local religious influencers. And we need to have a dialogue session. And we have did the same for polio program. We engage the local influencers, the local malaks, especially the tribal malaks. And we did a lot of awareness, and we need the same kind of awareness for COVID-19 too. Thank you, Osman.
Thank you, Mardil. Thank you very much. Now we are going to have a small talk from our colleague Vakar Khan. He is actually the one who manages alumni small grants opportunities in the whole of Pakistan. So I am pretty sure you would be interested to listen to him. He's not going to take much of time, but meanwhile, I want you to think about how alumni community can contribute towards this cause, the vaccine distribution and access in Pakistan. After Vakar has spoken to you and delivered his talk, we are going to very briefly touch the ideas that could be, of some usage for us. Or how can PUAN contribute? So Vakar, over to you. Please educate us on alumni small grants.
Yes, thank you, Usman. So this is for all the PUAN members, this opportunity. Among many other opportunities that PUAN offers to its members, this is one of the, I would say, most premier opportunity and most sought after. So basically, if alumni has an idea to do something in their community, and they are looking for some funds, this is where alumni small grants comes in. This is, again, community-based projects. So it will not cover research-based project or international travel or attending some conferences or writing a book. If you feel your community can be benefited with some project, you have some idea, and community means anything around you. That can be your neighborhood, your job place, your school, your village, your town. So we do this 3 or 4 times a year. We just closed the last cycle a couple of days ago. Next cycle will be in 3 to 4 months, and it will be announced on all our social media outlets. Usually the funding goes up to a million Pakistani rupees. We announce special themes on each cycle. If you have a project around one of those themes, you can request up to a million rupees. And if your idea is not following one of the themes, then you can still send us the proposal. The budget will be around $500,000 rupees. Lately, because of the COVID and everything, we've been doing only virtual ideas where people do these kind of things on Zoom and awareness and skill buildings. So those were slightly less budget items. Another thing, if you have a really great idea and you think million rupees is not enough, you can still talk to your alumni coordinator, and we can discuss those. And we have other opportunities, which is called mission initiated ASCs. This is all I have for now. And if you need more information, you can always send me an email about this small grant opportunity. Email is alumni small grant mean asg@usefp.org. I'll put it in the chat box so you don't have to write it. And then you can also visit the blog page, which is pakusalumninetwork.org. So if you have any question, you need more information, just shoot me an email and I will reply to it very quickly. Thank you, Usman.
Thank you very much, Waqar. Thank you very much, Waqar. So now the house is open. Anybody who wants to very briefly, 30, 40 seconds, 45 seconds, if you want to share an idea that how alumni community can, play its role to bring awareness in the people and, the myths and then the misinformation that could be cleared. Please share your ideas with us. We are interested to hear them.
I have a question, Usman, for...
Yes, Waqar.
Osama was talking about people are asking for a specific vaccine. But I think if you're looking at the other side, there are certain times when you need a specific vaccine. So my question is, somebody took some vaccine 2 or 3 months ago because that vaccine was only available at that time. But now the country he or she wants to get in wants some European or American vaccine. So now what? Can they do it again? Or like, because Saudi wants a specific vaccine and I believe Canada wants a specific vaccine, and I didn't know this 4 months ago. So now I have to go to Canada. So what should I do?
I would like to give an opinion about it. At this point in time, it is recommended you can take any vaccine if you want even if you finish your 2 doses, for example, of Sinopharm if in Pakistan. And after 3 weeks, you can take a dose of any other vaccine. It will increase the immunity. There are studies coming in, like for example, if one dose of, if Sinopharm, for example, is taken, a person can take the second dose of AstraZeneca also. So new studies are coming in, and lots of people have gone to America and they've taken the Pfizer dose. Even they had completed their 2 doses of Sinopharm in Pakistan, and they have taken Pfizer dose in the US after a month's time. So there's no it's been seen that the immunity has increased. Maybe a little fever and a little body ache might be. So that's about it. So it's at the moment the studies, all the international studies say that it's okay to take another vaccine after the dose is completed of another brand.
Thank you very much, Dr. Farhan. Now we need to wrap our discussion. Is there anything that alumni group want to share with us, or any idea very briefly, maybe 1 or 2 minutes? Faisal Abbas, please.
Just to add to this vaccine politics and all, very recently a friend of mine got a fellowship to go to Germany for his postdoctoral research. He already got Sinovac, I think, or Sinopharm. And now in this month, he has embassy appointment at German embassy. They asked for, I think, AstraZeneca or Pfizer, one of them. he talked to the vaccine people and they said that before 3 months, we cannot give you any dose of any other vaccine. And that's one of the challenges that he's facing. So I just wanted to add that this is also going on.
Faisal, my sympathies to all those people who have to travel internationally during this pandemic. This is such a crisis. So anyway, thank you very much, everyone. Let's take a picture now. Shanila has been waiting since 1 hour now. She asked me to take the picture in the earlier half of the program, but let's take a picture now. Please switch on your camera so that she can take a picture. And don't forget to smile.
Yeah, just wait for others too, who are still trying to turn on their camera. It's completely a voluntary gesture. If you don't want to be part of the group photo, so keep your videos in the off mode. I guess maximum people have turned their videos on. So on the count of 3, 1, 2, 3. Let's take another one. There we go. 1, 2, 3. Perfect. Thank you so very much, everyone. Over to you, Usman Sab.
So, I guess there is a message. WHO approved once anywhere might be a solution. Okay. Shahid Saab has, given his take on the traveling. Faisal Abbas Saab, you want to say something? Or we will have closing remarks? I believe it. Yes.
Go ahead. Go ahead.
Okay. Lynette, you want to say something as closing?
Yeah, thank you so much, everyone, for your participation today. It's been very interesting for us to listen and kind of gather information about how the situation is outside of that embassy compound. I really appreciate you taking the time. We're sensitive to your time constraints, and thank you so much. I know both of our countries are committed to making sure that we have as many people vaccinated in the public as possible so that we can go back to the interactions that we have been missing throughout this pandemic. And so again, thank you for your time, and I hope that the next health interest group meeting could be in person in a safe and a possible way. Thank you.
Thank you very much, Lynette. Osama, we have taken your point for your suggestion. We are going to discuss internally, and if there is a possibility of proceeding on that, we will let the group know. And thank you very much. Happy Friday. Have a good weekend. Nice weekend. Enjoy with your families. Take care and bye-bye.